Welcome to the Fascia-Informed Therapist podcast, designed for health and wellness practitioners interested in fascia science. I'm Amy Mayer, occupational therapist, practice owner, author, and educator with more than 30 years of experience using fascia techniques across many settings. Each episode brings practical insights and thought-provoking conversations to help you expand your skills and better serve your clients. Let's get started. Hi, this is Amy, and this is another edition of the Fascia-Informed Therapist. Today we're going to talk about how your mindset shapes your health. This podcast stems from a series of social media posts I was seeing about a Harvard study that was done on positive affirmations that were directed at your own body, and how this could influence the state of the immune system. And they were saying how saying things like, I am safe, my body is healthy, other body-focused affirmations could change your immune system in under 2 weeks. And they were saying this was compared to taking supplements, and I don't remember what the other comparisons were. And I thought, wow, that sounds maybe a little too good to be true, but wouldn't that be cool if it was? So I went out in search of this study and found out that this study does not exist. So there you go. Can't believe everything you see on social media. What a surprise. Okay, so I did decide to do a search of what I could find on that particular topic, and this topic appeals to me greatly, as it should to all of us, for our own health, but this podcast is, of course, designed by an OT for OT practitioners and anyone else who cares to listen. We all have clients who struggle with healing and mindset, and I have clients who are continually stressing themselves out, that are angry at their bodies, that continually call their bodies my bad shoulder, my bad leg. I have a client who will actually make a fist and hit whatever part of her body is not feeling well when she shows up for her appointment. And, I'm so mad at my hip, or I'm so mad at my back. And it's so frustrating, my stupid back. And I've talked to her endlessly about mindset and how important it is to be more gentle with your body. And I've encouraged her to go see someone, a counselor who could potentially work with her on stress levels. She also has perfectionism tendencies and a whole other list of things, but she's not an isolated case in my practice anyway. There are so many people who refer to their body very negatively when dealing with pain, especially. Also, but it extends beyond that. It also goes into, I'm so frustrated because I'm not doing my stretches, or I'm so frustrated at myself. I'm so angry at myself for not doing my exercises. I know if I did this, or if I ate better, whatever, that I would probably feel better, but why am I not doing it? So mindset is a very important thing, and I'm always trying to find ways to improve the healing trend line for my clients so that they can heal more quickly and maintain a higher quality state of health. We know that fascia and the nervous system are intricately connected, and when we have more stress, that creates tension. Tension creates more fascial density, and that density puts pressure on other systems, which then can cause pain or prevent healing. So when we're talking about mindset, let's first talk about what I mean by this, and that will help us look at the study that we're going to talk about here in a little bit. So I'm sure everybody's practice is different, and I joke with my friend Lisa, who does the emotional myofascial healing workshop with me, and we refer a lot of clients back and forth, but I sort of refer to my people, they're the people that are clients in my practice, as the body people, and her people as the head people, who sort of think that they come to her because of how they think, and they want to change and influence how they think, but my people want to come and change their body. They want to change something mechanical. And so when I'm trying to get my people and convince them that your body is part of the equation and you need to think about what's happening there as well, they're not so quick and easy to believe it. And same thing, the counter is then true with Lisa's folks, is that the body is part of the equation. You can't separate the mind and the body. They work together. So when I'm talking to my people about how you got to have a positive mindset, you got to have positive thinking, they are often turned off by that. They think it's forcing optimism or ignoring the real problem, and I can't pretend everything is okay when it's not. But that's not at all what we're talking about in this particular situation. So when we're thinking about a healthy mind, and sorry if you're hearing, hopefully you can't hear a lot of background noise, but I am sitting outside. I'm on my vacation finally in Arizona, and yeah, it looks like a motorcycle just went by with a lot of engine power. Anyway, yes, I am sitting outside on my friend's front patio watching birds and listening to, generally most often, healthy nature sounds. Anyway, okay, so what do we mean? Health mindset. This is, do we believe, do we have a growth mindset, or do we have a fixed mindset? And a health mindset is really how any particular person interprets their illness, healing, symptoms around the illness, and their own capacity to influence their health. And I think that's one of the coolest things about fascia. There are so many opportunities where clients can be empowered to change their health. Okay, so a growth mindset essentially means that they believe their actions or choices and support systems can influence their well-being even during the process of an illness. They believe there can be change. A fixed health mindset, basically the belief is that whatever they're experiencing and health-wise is predetermined, and there's basically nothing they can do, or they're completely reliant on the medical system to do whatever it is that needs to be done to them. And maybe that's actually a blend. Maybe they believe that they may be able to be cured or fixed by something external. But the growth mindset really focuses more on the actions of the individual. There's something they can do to make a change. The other concept that should be thrown in the mix here is the concept of mindfulness and awareness without judgment. Mindfulness is basically the skill of paying attention to the present moment with curiosity rather than fear, resistance, or judgment. Mindfulness is not even anything close to saying everything is okay. It's just observing what is happening right now. And I recently saw a post by someone that I follow who is a former monk, and he was talking about how, and I love Buddhist philosophy. Those of you that are not familiar, Buddhism is not a religion, it's a philosophy. It's a mindset, it's a set of beliefs, and maybe that'd be a really cool podcast to do at some point. But I thought what he was talking about in this particular video was about we all have experiences as human beings. All of our clients are having experiences. We're having experiences as practitioners. And that's a constant process, right? So we can, as practitioners, as human beings, can observe that we are having an experience. We have that ability to separate that observation from the experience. Now, where things get a little tricky is we're also really good as human beings in creating stories. What is the story around this experience? And in our case of what we're talking about today, it might be the experience of an illness, of experience of having pain. And we create a story around it. But we have to not just observe the experience that we're having, but we have to observe the story that we've created around it. And how accurate is that story? Is there truth to it? That observation is equally as important, and that is a piece of equally important as the experience itself, and that is a component of mindful. Observing the story, not judging it, but maybe another layer of analysis to the accuracy of that story. Okay, so we've talked about mindset, health mindset, we've talked about mindfulness, and now let's talk about positive thinking. We touched on this a little bit early. It's the conscious act of finding the positive side of an act or an encounter, and it's not pretending. It's choosing where to place the attention. And in many cases, the positive thinking can be, and this can relate to gratitude as well. The positive thinking, we may not be able to find a lot of positives about an experience of pain, but can we find something positive that is surrounding that experience, in the periphery of that experience? What can you find that is still positive in your life? And then let's layer on gratitude. Can you be grateful for it? It might be, yes, I'm feeling a lot of pain in my right shoulder today, but I'm on vacation and I'm looking at beautiful things and I have time to do some research and think about a podcast that I might think is really meaningful. So positive thinking might not be the experience itself, but what is happening around that. And in the article that we're going to talk about, Dr. Eric Kim is highlighted, and he says he's not one of the authors, but they refer to him in this article. And his research says that most optimistic individuals have a reduced risk of death from major diseases. And it's not because they deny the problems, but because optimism reduces chronic stress, increases healthy behaviors, and in turn improves physiological function. And that's essentially the article that we're going to talk about. And if you're curious about this Dr. Kim, which I was, so I went and looked him up. He's an assistant professor of psychology at the University of British Columbia and a research affiliate at Harvard's Human Flourishing Program and the Lee Kum Shung Center for Health and Happiness. And his research is about identifying, understanding, and intervening the dimensions of psychological well-being and social connections to promote healthy aging. Anyway, so positive thinking is not just about, hey, try to be happy, try to be cheerful. It's about many other aspects of thinking about life and observing the situation that you are in. Okay, so here's the article that I found, and the article is titled A Psychological Exploration of the Power of Our Mindset and Its Influence on Physiological Health. And I found this article in PubMed, and the journal is Cureus, C-U-R-E-U-S, which the journal itself is not an extremely high-ranking journal, but the articles that they cite in their lit review do come from pretty high-ranking journals. Now, the authors, the first author, the last name is Parsamannesh. I'm going to try Parsamannesh. And this author is from the Clinical Sciences St. James School of Medicine in Chicago. And the second author is Vysochyn, Vysochyn. And this author is from the, Cardiology St. James School of Medicine in the Valley Anguilla. I had to look that country up. Okay, so we're talking about mindset essentially as medicine. And what does this article say in their lit review? So it's not just something that is psychological. It's, can we apply measurable physiological effects? Okay, so they looked at, this is a 2024 article also, by the way, so it's fairly recent, and they looked at 9 different studies that met their inclusion-exclusion criteria. And as fascia-informed therapists, we care about this because of what I talked about earlier. We care about the healing trajectory of our clients. We want to give our clients many strategies for healing themselves and not become reliant on our hands and doing any one particular technique for them to become reliant on to feel better. We want them to see us as a choice, as an option, and if we truly care about our clients, we're empowering them with lots of strategies that they can do themselves to improve their healing and stay well. We know there are so many things out there that are constantly causing stress, tension, greater fascial density in the body, sedentary behaviors. There are so many things coming at our clients. We can't possibly do enough to keep them whole and healed and feeling great completely with what we do. We need to empower them and give them strategies as well. Okay, enough of that. So what's the hypothesis? The central hypothesis of this paper is that our mindset is powerful enough to influence physiological health in either direction. So it can make things better, or it can potentially make things worse. Okay, so this article is not about manifestation culture, and I think that's what a lot of my clients think about when I start talking about this is, am I going to get all woo-woo on them and talk about manifestation, where I do not think manifestation is a bad thing. I think it's really cool, and I read about it myself, and I think there's definitely an intersection between manifestation culture and why it works, because there is this physiological aspect to it. Okay, so we're creating expectancy, perception, we're changing and influencing neurobiology by influencing when this attitude can actually change behaviors. So 2 terms that you all may or may not be familiar with, placebo and nocebo. So placebo is when there's a positive expectancy, the symptoms improve. A nocebo means there's a negative expectancy and there can be worse pain or poorer cognitive performance or more distress. And they're not imaginary. These are brain-driven physiological processes that involve attention, emotional regulation, autonomic activation, and neuroimmune pathways. So let's talk about the studies highlighted here that you will likely be interested in. The first one talks about a growth mindset, and this was the use of oral pain medication and whether or not they reported less pain after surgery. And that the study definitely showed that perception shapes pain interpretation and not just coping skills. There was a couple studies where they looked at how induced health-oriented mindset reduced attention to high-calorie foods. So this one was about eating behaviors and how their attention orientation shifted portion choices. And how they thought, their mindset influenced interoception around cravings, and then also how they regulated themselves. Okay, I'm going to go fairly quickly through these studies, and then we'll spend more time on the conclusions. But I will, of course, include the reference, so you can go back and look at the studies themselves if you choose. Okay, so another study was on sleep and cognition, and participants who were told that they slept poorly performed worse on cognitive testing, even if they actually slept fine. And those told they slept well performed normally. So essentially, they were able to mimic what sleep deprivation looks like from a cognitive perspective just by telling them they slept poorly or they slept well. Another one was on aging and mindset. And older adults with a more positive self-perception of aging lived 7.5 years longer, showed better memory, slower hippocampal decline, and reduced dementia risk, even when they had genetic predispositions. That is freaking fascinating, I think. And we do, in our culture especially, we have such a cultural expectation around aging, what we're supposed to do, how we're supposed to live, what we're supposed to wear, how we should cut our hair. I mean, everything. There's such a cultural expectation that we're going to hurt more, that we're not going to be able to move as well, that we're going to have to start thinking about finding a ranch-style home so we don't have to do stairs. So there's clearly a mindset around aging, and that this study tells us that a more positive self-perception and approach to that can make a massive difference in those. And I would imagine those 7.5 years longer are not just chronological years, but they're actually probably healthier years as well. Another study on surgical outcomes. Post-operative results after carpal tunnel release were strongly influenced by expectations and illness beliefs. Patients who expected a positive recovery, experienced better functional outcomes. And I believe that study, I don't have that in my notes, but I believe that study was also they tied in how the practitioner presented information to the patients. Mindset and illness interpretation in adolescence, so this applies to the youngins too. Youth with a fixed mindset viewed illness as catastrophic and were less likely to engage in healthy behaviors. Growth mindset predicted resilience and more adaptive coping. Let's see. Okay, so the article then synthesized the 9 studies, and here are some of their conclusions. One, that they conclude that their hypothesis was accepted. The mind and body are deeply interconnected. Mindset meaningfully influences health outcomes. And the key points: psychological and social support during illness improves well-being. How patients understand, interpret, and emotionally process a diagnosis affects their overall experience. A growth health mindset leads to better outcomes than a fixed mindset. People who believe they can influence their health are more likely to engage in beneficial behaviors and experience improvements in quality of life. A fixed mindset, people feel stuck and they see fewer gains or improvements. A positive mindset can benefit physiological health even when genetics or baseline health challenges exist. Attitude doesn't cure disease, but it shapes the stress responses, changes your coping behaviors, and improves your overall function. Cultural and personal stereotypes shape behaviors and perceptions. In the eating behavior example, beliefs about what is healthy or unhealthy can override the physical cues like fullness or satisfaction. Another example, in serious diagnosis like cancer, viewing illness as catastrophic can lead to withdrawal, depression, poor outcomes, whereas seeing it as manageable or meaningful can support resilience and engagement in life. This episode of the Fascia-Informed Therapist is brought to you by me. I offer Fascia-Informed CE for health and wellness practitioners both online and in person. Whether you're looking for flexible self-paced courses or hands-on in-person workshops, you'll find evidence-based practical tools you can apply right away in your practice. Visit fasciainformed.com to explore upcoming offerings and take your next step as a fascia-informed therapist. Now back to the podcast. So what does this mean to us? And this, when we talk about this, I always think it's important because I think about what this means to me, and I think you should think about what it means to you, but then we also need to think about what it means for our clients. So here's some things to think about. How you interpret your symptoms shapes your physical trajectory. And like I said at the beginning of this, I'm always trying to think of ways I can improve the healing trajectory for the clients and give them scientifically sound suggestions. Because people have a lot of assumptions about their diagnosis. They have assumptions about pain. They have assumptions about their bodies. They've read or heard stories about people with whatever diagnosis, fill in the blank, back pain, fibromyalgia. You know if you've ever experienced back pain or plantar fasciitis or whatever, everybody's got to tell you their story and everything they did to try and heal it and how long it took. And so that starts to shape our beliefs about what's going to happen to us. But what we can tell people is how much any specific diagnosis or experience of pain or even their individual bodies vary. These things vary dramatically. There's a huge spectrum of what pain is, of the health of a body. And any given diagnosis does not mean one specific thing. We want them to feel less pinned down to any given story and to feel more empowerment in how they interpret their own symptoms. We want our clients to believe recovery is possible, that they can change their pain, they can change their behaviors, they can even change the structure of their body and their brain. And like I said, my clients are often turned off by things like, if you believe it, you can become it. But they are open to science. And when I start talking about those things, that creates a level of trust. And again, and I've talked about this in other podcasts, you have to take the science to a place that they can understand it. Self-talk about aging, illness, or limitations has long-term health consequences. And this is a hard shift. We were never taught that what we believe has a direct consequence on our physiological makeup. And I talked about this earlier, that we often refer people to a counselor, someone who understands physical pain, diagnoses, and can help them with those mindset shifts, because this is a hard thing to do for a lot of people. The other thing to think about is the words that we use as clinicians matter, and we can unintentionally make things worse. And I really have to grit my teeth and keep my mouth closed when clients come in and tell me that another provider told them, oh, my other provider told me this was the worst case they've ever seen. Or another body-based therapist said, oh, your body feels like stone. Or I've never seen anybody tighter than you. That frustrates the heck out of me. It's important to validate a client's experience, but to tell them something that makes them believe something even worse than the state that their body is probably actually in, because bodies might feel tight, but do they feel like stone? No. But what is that creating in the brain of a client? When practitioners say things like that, it feels to me that we're trying to make the client feel like they can't do without us. You need it sounds like a sales job and something to make them more reliant, to keep them coming back, rather than something that is empowering to them. So I might respond like, yeah, this feels tight, but it's certainly not something that can be changed or managed. Our bodies are incredibly adaptable. And here's the things that we can do to start changing your body. And yes, it's going to take time, so you'll have to be patient, but I'm going to give you lots of strategies that you can integrate. Your mindset doesn't cure disease, but it can dramatically influence the quality of your life, your pain perception, your behavior, and your emotional resilience. So here's some things to think about for yourself, for your clients. What stories are you telling yourself about your body or your health? Because we all do it. What expectations are you setting for your clients, intentionally or unintentionally? Could reframing your mindset help shift your own physiology? How can you help clients reframe their mindset? And things I often do is, if someone says or refers to a part of their body as bad, I simply say, hey, can you just flip that? Let's flip the script a little bit. Let's say this is the shoulder that's healing, not the bad shoulder, the shoulder that needs a little extra TLC, that's in the process of healing. What beliefs about aging, pain, or illness have you absorbed from culture, family, or past providers? And how can you begin shifting those? How can you observe your own story? How can you observe the story of your clients and help them make those little shifts? And then also, do you have someone in your network that you can refer to if a client is really struggling with this and it feels out of your scope to help them make that shift? So, I hope that this episode has helped you think a little bit more about how you can help clients make that shift, because we know the mindset has a direct impact on physiology, and fascia is part of your body, so it's going to affect the fascia as well. All right, thank you so much for listening, and if you want to check out that article, that lit review, in more depth, I'll be sure to include that. And thank you so much for listening. You've been listening to the Fascia-Informed Therapist podcast. Be sure to subscribe so you don't miss new episodes. And if you'd like to go deeper, check out my continuing education courses, both online and in person. You can find them at fasciainformed.com. Thanks for listening, and I look forward to next time.